people in modern urbanized societies are more likely to suffer from heart disease. What are the reasons for this increase? There are many contributing factors that can lead to heart trouble. How can people better recognize and avoid harmful influences? Due to the large territory and population of China, there is imbalance in the distribution of medical equipment and development of procedures. What policy changes can help narrow the gap? CPR is short for cardiopulmonary resuscitation, an effective technique for saving people in danger. How widespread is CPR education in China, and what can be learned from other countries' experience?
With increased urbanization, lifestyles in China continue to change dramatically, and along with the many benefits, there are also costs. One of these is an increase in the rate of heart disease and heart attack, which has been rising nationally. What factors contribute to this rise? What can individuals do to help themselves stay healthy, and how can the government and the medical establishment work together to improve people's lives and their well-being? To discuss these issues and more, I'm very happy to be joined in the studio by Dr. Zhao Dong, Professor of Medicine at Beijing Anzhen Hospital, affiliated with the Capital Medical University, Dr. Chen Guanghui, Senior Cardiologist from the PLA General Hospital, Beijing, and Dr. Helen Krumhaus, Professor of Medicine at Yale University and a recipient of the Friendship Award from the People's Republic of China in recognition of its collaborative efforts to develop a national cardiovascular research network. That's our topic. This is the dialogue. I'm Yang Ray. Welcome to our discussion here about heart disease and heart attack. This is a very interesting topic. In fact, it's becoming more important for middle-class consumers in urban areas. What are the most important things that people need to know to avoid having heart attack or heart disease? Dr. Zhao.
I think there seems not very complicated. There are 7 things I think is essential for heart health and highly important for heart prevention of heart disease. I think number 1, your weight. Number 2, your diet. Keep the balanced diet. And number 3, no smoking. Keep regular exercise. Then pay attention to keep your blood pressure normal and keep your cholesterol normal, keep your glucose in the serum glucose, the glucose in your blood normal. That's all. If you keep those 7 things in optimal level, so I think the chance for the heart disease, you can keep your heart very healthy and also very low probability with heart attack.
But what about the DNA of your family health?
Well, there's a lot of factors that's involved in heart disease. And one of the things to know is that it's really the success of China, the modernization, that's led to heart disease becoming much more common.
Excuse me, you mean the success of China is to blame?
There's been a big transition from maybe the diseases that were more common in China 50 years ago and 40 years ago. The success means that they have the diseases of wealthier countries as people are moving more towards middle class. And it means that it's really about the behaviors. The fact that people move from a society where, I remember in the 1980s when bicycles were all you saw in Beijing. Now all we see are congested traffic.
You know, because the United States is the role model. You are a nation on the wheels.
Yeah, you don't want to follow us on this path.
We follow the United States so whatever the cost.
So, in fact, we have led the way on what we are calling non-communicable diseases, diseases that aren't transmitted by infection but are transmitted by lifestyle, by a cultural shift where we go to fast food and sedentary behavior and many of the actions that end up leading to risk for diseases that weren't seen in a society that didn't have such opportunities. And so it's important for us to say we don't want to go back, China doesn't want to go back, but how do you have a successful, economically strong country and yet avoid many of the diseases that often accompany that success? And it means that the society needs to focus on how we help people to follow behaviors which lead to better health, how they can create a better environment, and how we can encourage those behaviors which will help them be healthy. At the same time, we have to strengthen the healthcare system so we can be sure that there are the appropriate response to people who do develop these risk factors, these conditions like high blood pressure or high cholesterol, so that at the same time that society is moving forward to encourage health, people are doing their best to make sure with their doctors that they're approaching the risk factors to give themselves the best chance of good health for their entire life.
Now, Dr. Chen, let me go back to the issue of lifestyle. Do you think the remarkable improvement of lifestyle of particularly the middle class in urban areas has contributed a lot to the increase of heart disease now?
Yes. Firstly, I have to make clear, when we refer to heart disease, usually the heart disease nowadays is divided into 3 categories, or we call it subspecialties. One is structural heart disease, and one is the electrophysiological heart disease, or pacing or conduction systems disorders. And finally, is the coronary heart disease. When we talk about heart disease nowadays, it's about the coronary heart disease, or we call it chronic heart disease. So for this category, the heart disease is attributed a lot to the lifestyles. If we can successfully and effectively change the lifestyle, I'm sure, or we can see the great decrease of the coronary heart disease to a great extent.
But I think the constructive heart disease currently is the basic reasons. Many of them is based on it actually is caused by the coronary heart disease. So you can find many heart failure patients, actually the original reason is ischemic heart disease. So I think they're related.
Yeah, but I think the lifestyle mostly changed the rate of morbidity and mortality of CHD, heart disease,
so maybe
heart attack.
We should be, I think you're exactly right. For the audience, we need to make clear that there are many kinds of heart disease, but maybe we should be talking about heart attacks and stroke, because together the cardiovascular disease of heart attack and stroke, where maybe blood vessels get blocked and blood flow gets restricted and damage occurs, those things are very much under control of behavior and lifestyle. And in addition, they can be very much mitigated. The improvement in the health can occur through change in lifestyle with good constructive interaction with healthcare system. We know so many people have high blood pressure, they don't even know it. We know many people have risk factors. They can both seek to work with their doctors, but also have the opportunity to change their behaviors in ways that can help them. So, but you're exactly right. We should be talking more about, in this case, heart attacks and stroke, and let people know there are other kinds of heart disease also, but this is the epidemic in the society that as it moves to an economically stronger society, more people move to the middle class, the behaviors lead to a surge in the numbers of these events, which can be devastating for people and their families.
Well, I'm afraid one embarrassing story for the middle class families is that the age of the heart disease patients seem to be getting younger and younger. Do you think this is largely an issue of lifestyle, because young people drink more unhealthy soft drinks, they hate to go to the gyms, they work under stressful circumstances because of the competitions in their respective professions? Yes,
I think that's an important point. Actually, if you see the Holland actually go back to 1980s, in one generation we have very, very low incidence rate coronary heart disease. Then, but 30 years or 40 years later, there's many young people, they have AMI, they have acute coronary heart syndrome or or myocardial infarction. I think the basic reason is the rise the risk factor, because the unhealthy lifestyle, the smoking, elevated cholesterol, and hypertension. And the stress for work is also some environmental factors like pollution. But I think the major one is unhealthy. The 7 things I'm talking, I think we have many evidence to show those are most important factor related with the increased heart attack among the young people.
Harlan, can you talk more about the prevention itself, so that
we
all increase the index of happiness, the prevention and control of early prevention in particular?
Well, and you're right that we are starting to see a surge in the number of younger people with the disease they've lived their whole life within this new China, which is less physical activity and more of a different kind of lifestyle, more of
exposure to the risk,
a modern
factor.
society
Yes,
lifestyle
modern
that leads
society.
to modern society diseases. I think one thing that's important, though, is for us not to appear to always to the public seeming like we're telling them, don't do this, you can't do that, and scaring them. Instead, I think we need to inspire them that in this new age, we have the means to help people live long and healthy lives, that embracing a healthy lifestyle is not just about preventing disease, but it's about living at a higher level of function, being more physically capable and being able to enjoy life more. So that we need to inspire people that when they smoke or staying physically inactive or gaining a lot of weight, it can not only diminish it can not only increase the risk of heart problems, but it can diminish their enjoyment of life. We need to be, I think, sending positive messages that it's under their control to some extent. Now, it also can be family history, so people need to pay attention to those things. Some people can do all the right things and still they can get heart disease. We need to be careful not to blame people when heart disease happens, but we want them to feel the power to be able to control their destiny to some extent,
but
and that they can engage in these things.
But
Yes,
I think
I-
that's two
Dr.
aspects.
Ted,
Yes, I totally agree. As a medical professionals, we will always stress the lifestyle, the better lifestyle or better life habit contribute to the rate of high rate of
High risk,
coronary heart disease. But as a people, we should balance life and health. If we just stress too much about the health, then it will scare the people.
You
They
sound
don't know
like
how to live.
you sound more like a philosopher. You need to develop a better,
But
relationship between cool, stylish lifestyle and your health. But don't you think this is structurally contradictory against each other?
But I think there's two aspects. The first is what we should do, what we should tell people to keep, what factor, most important things for them to keep their heart health. Another is how we do it. I think you talking about create healthy environmental to promote the healthy environmental and help people to have a more better heart health. But the things is what we promote. The people should know, very simple. The factor, simple, is related with heart health.
Let's put aside the issue of prevention for the moment. Dr. Chen, China is very special for the Social Security program because we have still millions living under the poverty line. We need to lift them out of the poverty. We need to reduce the illiteracy rate. Having said this, do you think it is a big problem for farmers, peasants from the underdeveloped areas to receive timely medical care before they are killed by the heart disease?
Yes. In China, the medical facility is uneven. Is well known. So, as a in this government, it is all at different level of organizations to set up more medical facilities in the undeveloped area, countryside. Then it will be convenient and easier for the poor people to directly go to see the doctors, and the doctor is qualified and certified that they can do the rescue. They know how to prevent, how to treat the patient with heart disease.
Well,
so it's very important, I think so.
I so agree with you. And one of the things we're trying to do, and I've been very privileged to work with Fuwai Hospital and the National Center for Cardiovascular Disease in China. And one of the aspirations is to be able to use technology and communication and linkage between village doctors and township hospitals and specialty centers in Beijing, so that people aren't isolated in getting care in rural areas, but they're connected in a way that they can get the support for the decisions that they're making with the patients and be able to be trained and integrated into a larger system that's communicating, so that the Chinese healthcare system is one in which there's communications and connections between the major centers and the farmer and those areas. And so what we're trying to do is ensure that people are getting the appropriate care. One of the most amazing statistics in China are the number of people who have, for example, high blood pressure and don't even know it. or they have high blood pressure, but it's being inadequately controlled. So there's a wonderful opportunity here to bring together a system that's connected to deliver higher quality care, to make sure that the people, even in the rural areas, are more aware of what they can do, and that we're being sure they're getting the highest quality care. I see this as a very important initiative for China.
Thank you so much. You are watching Dialogue with Dr. Zhao Dong, Professor of Medicine at the Beijing Anzhen Hospital, affiliated with the Capital Medical University, Dr. Chen Guanghui, Senior Cardiologist from the PLA General Hospital, Beijing, and Dr. Helen Krumhaus, a Professor of Medicine at Yale University. He is also a recipient of the Friendship Award from the People's Republic of China in recognition of his excellent collaborative efforts to develop a national cardiovascular research network in this country. We are discussing issues concerning prevention and therapy of heart disease and heart attack in developing countries, particularly in China. We'll be back in a short while. Stay with us, please. Welcome back. Now, Dr. Chen Guanghui, so many people nowadays prefer to travel to the Sunshine Province in China, Sanya, or Hainan Province. But the number of hospitals there is quite limited, I'm afraid. The medical resources are quite limited. What are your suggestions, Dr. Chen?
Yes, heart attack is very devastating to the society, to the union, to the unity, and to the families.
Excuse me, can you first of all talk about the first aid?
For the first aid, I think I totally agree. The time is very, very important. So we as a medical cardiologist, we say time is life. So for the first aid, the patient should keep quiet and let the patient lie down. And as a family members or the bystanders should clearly diagnose if the patient has the heart attack or has the cardiac death, and then you can start first aid to the patient effectively and efficiently.
So this issue of timing is so important. We've just completed a study in China all around the country looking at the amount of time it takes from when people first have their symptoms to the time that they get to the hospital. We know for many types of heart attacks, if we get to the patient to the hospital very quickly, we can institute therapy that can very much minimize the damage. But in China, often people are waiting long periods of time before they even alert anyone to the symptoms.
Are you suggesting that the use of helicopters is the best and most effective way
No, I don't think so.
for effective therapy?
The first and most effective way is when people have chest pain or pressure and they feel maybe that it's difficult to breathe, that they call their doctors, they activate the system, they let people know. Now, here in China, as in the United States, we need to work to make sure our systems of transportation can move people to the hospital quickly. Of course, we can't afford things like helicopters, but we can afford and are able to move people quickly. But the principal reason for the delay is people, I think, at home are thinking, I just hope this will go away. I hope it's not something important. And we, doctors, need to encourage people, if you have the sudden onset of these symptoms, you need immediately to let people know. And you can activate a system. Allow yourself to be evaluated, because you can be losing precious, important minutes, which can threaten your life. So we've been telling people, don't be embarrassed. Don't worry that maybe you don't have anything important. People don't want to be in imposition. But you really need to be evaluated quickly. And China, like the United States, has the same issue. In China, it seems to us it's even worse. People are waiting longer. Maybe they don't want to inconvenience their families, or maybe they worry about cost.
Well, you guys have talked about the importance of issues such as transportation time and awareness about the urgency. But what about the immediate use of a medicine? Something that you should carry with you all the time. Because taking my parents as an example, they have developed their heart disease. My mother knows clearly that it's very, very important to have the medicine always with her around the clock, so that before the ambulance comes over, they would adopt different approaches, including the use of medicine. What do you think of this awareness?
I think that is very, maybe it's important for your mother, and some people already have a history of heart attack. But for most people, as I know in China, the people die the first time, they don't have a history. And the young people, they died outside the hospital. So among those people died from coronary, 60%, even 70%, they died outside the first time.
I heard many stories who died of heart disease in the toilet.
Yes.
Why? Why this occurs very often?
Well, there can be stories of people fainting, particularly on the toilet. I'm not sure that there are many studies showing that heart attacks occur more often on the toilet, but we do know that there are conditions where people are under extreme stress, or where people are under extreme conditions, where they can be put in positions where they're at higher risk. But the most important thing, I think, is not that people try to treat themselves when they've got a heart attack, but that they seek help. And we need to create a system where, again, people feel free. They know that they can get help and seek it very promptly, as opposed to think they can manage it at home. I'm wondering what you might suggest, Dr. Professor Chen.
It's quite complicated. I think the first diagnosis to make clear judgment whether the patient is suffering from the heart attack is very important. Otherwise, you will do things wrong. So, to get the people trained, and I think if there's any possibility...
You need to get people trained. Training is important.
Yeah, even for the public, even for the common peoples.
So
and
here do you mean
I really ask...
Pulmonary resuscitation, cardiopulmonary resuscitation.
Yes, the CPR. So I'm in my own opinion, I ask for the government to set the course in a high school or even in a college or university to train our students to set a course. You must know how to do the CPR. It's very
So this
simple.
is a great idea. In the United States, actually, we only have one city that set a goal for this, Seattle. And in Seattle, they worked hard to train people throughout the city and also to work very closely with all the medical personnel. And actually, the chance of dying from sudden death outside the hospital is lower in Seattle than it is in anywhere else in the States. I wish in the States it would spread. But in China, too, the public can also be prepared. So if someone needs help, they can go to that person and help them, because we all know that if it's started promptly, the resuscitation, by even a layperson, person not trained, it can save time for then professionals to come in and save a life. I can tell you there's nothing more wonderful than someone who has had an event in front of you and would have died, than to jump in, be able to keep them alive until professionals come, and then if we can act promptly, they can return to their old life. And it's the most wonderful opportunity. It would be wonderful if in China people would learn this broadly, just as you're suggesting.
Yes, and also I think there is it's like a public places like airport, shopping, to have have some facility to like the ACD. Yes, to have people if some people happen that
As
you
I
can
know,
use that
in the Western
directly.
countries, in those places, they were all equipped with
yes.
defibrillator, automated defibrillator, and sometimes it can really save the patient's life.
Yes.
So these are machines that are they're built to be so simple that anyone can see someone is not breathing, they're lying flat.
Yes.
You can bring in and shock the person back and actually save a life. And the AEDs, they're called the automatic external defibrillators, they're built to be so easy that anyone can use them, even if you haven't been trained. To put them in the public places, it has been quite a good thing, particularly in airports.
Yes.
Actually, you asked me about bathroom, but the place where these arrests also occur, casinos. Actually, in casinos, they're very common. And they put these in the casinos.
High-risk place.
That's the place of stress and excitement.
Yes.
Actually, it's a high-risk also location.
Yeah. Which disease has the highest occurrence or incidence in developed countries? Cancer, heart disease, obesity, diabetes? What is it that could be listed as the #1 killer disease?
According to the state data, I think the cardiovascular, because the cardiovascular, so it includes heart disease and the circulatory stroke.
Stroke is #1 in China.
It's the leading in China. Leading cause of
coronary heart disease second. And diabetes actually is is much higher but diabetes is the risk factor. So diabetes cannot kill you immediately, but the stroke and heart disease can kill you directly.
You know, one of the major three concerns for President Xi Jinping at the moment is environmental decline because of the hazardous fog. Smoking is, of course, is a very bad reason behind the decline of your health. But what about the general environmental pollution, either in the air, in the water, in the food, in the earth? I mean, you cannot escape from these conditions of your life. What about the contributions of the environment to the...
There may be nothing more important that the government can do than to continue its work in cleaning the air and to ensure that the environment is one where people are not exposed daily to the risk of pollution. We know very well that the air quality can contribute also importantly to risk. And when the air is not good, everyone is exposed. It's not like smoking where the smokers are exposed and maybe the people around them, but when the air is not good, everyone's exposed. As you know, in Beijing, there's been a lot of progress in air quality, but even many days still, there's more progress to be made.
With the improvement of medical equipment and facilities, is it possible to drastically reduce the costs of heart surgery? Because many ordinary families cannot afford to have a heart surgery, and particularly in rural areas, farmers would say, once I have had a very serious heart attack, I don't have the money, I don't have the resources to support a serious heart surgery. I would rather wait to die.
I think the cost of heart surgery in China is very low.
You mean heart surgery in China, the costs are very low?
Very low compared with the U.S.
Compared with the United States?
Yes,
look, I think China has made a lot of progress on health reform. Much of the early emphasis has been on the accessibility to care and affordability, the out-of-pocket cost. I hope China, like the U.S., continues to work on ensuring that ordinary people, the common man and woman, are not denied access to effective therapies. If we have effective therapies as societies, we need to work to make sure everyone gets access to them. This is a challenge, I think, for all societies, and particularly China on its journey to an economically leading country is going to continue to confront this issue about medicines as they become expensive and surgeries and so forth. But I think it has to work together to figure out how can we ensure that we're not wasting money on things that don't work, and how can we make sure that everyone, even the farmer in the rural area, that person deserves also to have the chance to have access to effective therapies. And so we need to continue to do studies and learn what works, and then to try to make it affordable for everyone. Maybe that means that for them they're paying much less, but it's unfortunate in any society if there are people who are excluded just because of their ability to pay. And we need to work for a society that's more equitable and fair. That's not easy in the beginning periods of change, but it's an aspiration that we have to continue to work toward.
Thank you so much.
Yes.
To conclude our very meaningful discussion about how to avoid heart disease and heart attack, our suggestions, I believe, is to have better food and a very good lifestyle, including a regular visit of the local gym. I will see you next time. Goodbye.
Thank you.